my name is Sky and I'm a radiologic technologist, and this is a video submission for my gender-based medicine assignment for my culture and human diversity class. Topic is gender-based medicine, and I'm talking to other rad techs in the field in particular. So let's start with the two subjects. We have sex versus gender. So sex is your biological factors. So this is your reproductive functions and how your chromosomes are expressed. So for example, women have two X chromosomes and men have an X and a Y chromosome. Gender, on the other hand, encompasses quite a bit more. This is defined as your identity or role in reference to culture or societal differences as opposed to biological differences. So in healthcare in general, it is important to remember that there is a difference for some people. Men and women process and metabolize things differently. So when it comes to preventative maintenance, prescription drugs, and even insurance reimbursement, the things are widely impacted by gender identity or gender-based medicine. For rad techs in particular, this is important to remember since we legally have to ask every female patient if they're pregnant, because radiation is unsafe for a fetus, especially between that 2 and 10th week. It's important that all patients know the risks, and just because a patient comes in and identifies as a male, if they still have female reproductive organs, we have to legally ask, and they should know the risks. Let's look at another example. So, say you work in an outpatient imaging clinic, and 99.9% of your patients are completely ambulatory, and chest x-rays are a dime a dozen. You go out and you call your patient Mr. So-and-so. You're walking back, you introduce yourself, and while you're talking to the patient, you're assessing him, and you see that Mr. So-and-so is a pretty laid-back guy. He's walking fine, breathing fine, not in any immediate distress, and he's also wearing a sports jersey. So this jersey has a lot of stitching, a lot of the thick paint emblem on it, and you decide, well, better to not risk the repeat, we'll have him just take his shirt off. So you get into the exam room and you say, okay, Mr. So-and-so, go ahead and pop off that shirt and put your chest against that cold hard board. And Mr. So-and-so gladly agrees, and he pops off his t-shirt. Once he does that, you immediately notice a brightly colored bra. Now, in this scenario, do you A, proceed as normal with the bra on, or do you B, apologize and politely explain that clothing, especially with metal hooks, can appear as artifacts and need to be removed before the exam can proceed, and escort them to the changing room where a gown is provided? If you chose B, that is the correct way. Well, I wouldn't say correct, but the best way to go about it. And this is actually what I did. I was 2 years on the job. I've been an x-ray tech for 6 years now, and this same exact scenario happened to me 2 years on the job, and I wasn't expecting it. It caught me completely off guard. I have worked with transgender patients in the past. It's just one of those busy days where you're plugging along and you missed it. And the best way to go about that scenario was just to be as polite as possible. Luckily, the patient in my scenario is very understanding. Moving forward, training of healthcare professionals and more epidemiologic studies and the things like drug research can go a long way to helping us provide optimum care for all of our patients. Thank you so much for watching my brief video. Obviously, this is a very broad subject that deserves our full attention. And the key takeaway here is that all of our patients need to be treated respectfully and thoroughly at the same time. So thank you so much. Have a good day. Bye.